The World Health Organization says COVID-19 is no longer a global health emergency. Positive cases, as well as the death toll, have decreased drastically across the globe. But here in South Africa, the Health Department has urged us to still be vigilant. Let's get an update on the outlook, particularly on the African continent, with the WHO's Regional Incident Manager, Professor Jayne Byakika-Tusiime. Professor, thank you so much for speaking to us this evening. So South Africa is saying we're still going to be vigilant here, despite the WHO's recommendation that there's no longer any need to label it a global health crisis. What is your position on South Africa's stance? Do you think it's wise to still be vigilant?
Now, we all know that, yes, the COVID fake was lifted. That is the public health emergency of international concern status was lifted by the DG on Friday. But that does not mean that COVID is not there. Actually, COVID is still present with us. Many people are still, catching the disease, and many are also still dying. But it's no longer the same as it was for the last 3 years. There's a great difference. There's been a great decline. And actually, when you look at Africa, for example, the situation has really been calm for the last couple of months. Like from January up to now, the numbers have been very, very low. Both the number of cases, the deaths and hospitalizations reported have been very few. And for example, for the last week, there were 1,012 cases reported in the continent, compared to about 2,500 cases the previous week, which showed about a 60% decline in the number of cases. And likewise, the deaths have also greatly reduced by over 60% in the last in the last month. So really, there's a great decline in cases, and that's why the WHO committee of emergency, the emergency committee, advised the DG to this fake. But that said, we know that COVID still exists, and people need to take care. They should not relax, and should continue with other, prevention measures like the vaccination if they've not been vaccinated.
So it's certainly a great relief to hear that we have had such a massive reduction in the amounts of cases, hospitalizations and deaths. Thinking back to the midst of the COVID-19 pandemic a year, 2 years ago, and 3 years ago, that was certainly a very frightening time for people across the globe. Perhaps you can give us an idea of the vaccine uptake across the continent, and where deaths are still occurring, whether it can be determined whether those are among people who have not yet been vaccinated.
So as of today, May 9th, there are over 1.1 billion doses of the COVID vaccine that have so far been received on the continent. And out of that 1.1 billion doses, about 806 million doses have been administered. But that said, only 31% of the entire population of the African region has completed their primary vaccination, so which means that we're still lagging in vaccination. And out of that 31%, actually, just looking at the Afro region itself, which does not include part of Africa, only 29% of that population has had complete primary series. And as we speak now, it's only 4 countries in the Afro region that have managed to have surpassed the 70% target of vaccinating their people, giving them the complete primary vaccination series, and that is Mauritius, Liberia, Seychelles, and Rwanda. So right now, the focus is on vaccinating high priority risk groups. And as we speak now, 49% of older adults and 46% of health workers have completed their primary series in the region. But this is only in about 24 countries on the continent. So among the people who are falling sick, hospitalized in the hospitals, actually the data also show that many of those people who get severe disease were not vaccinated. So we still see a protective effect of vaccination, and that's why we encourage everybody to get vaccinated, because it will protect them against severe disease.
Perhaps the counter-argument from many people would be that, if we have not seen, the vaccine uptake surpassing 70% of population in many countries, that the reduction in infections and in serious cases, could be attributed to natural immunity based on getting COVID-19. But what is your advice to people to still go out and get their vaccine, despite the fact that it seems that cases are very much under control?
The truth is that we are living under a lot of uncertainty. We don't know what is going to happen tomorrow because of the nature of the virus. So we could get more virulent variants of the more virulent variants that may cause more severe disease. So to be on the safe side, we really encourage people to really boost their immunity. Yes, I know some people have gotten immunity out of, infection. Those who are infected, they naturally got that immunity, and then others from vaccination. But really, because of that uncertainty that we have about this virus, it is really better to get protected with vaccination, because it really has a protective effect, and it has been confirmed with research and other studies.
In terms of the vaccines themselves, as we've seen a progression of variants throughout the course of the pandemic, experts in the field have continued to, assure the public that the vaccines available currently continue to protect against these new variants. If you're talking about the possibility of more virulent variants in the future, we know that that's uncertain. We can't say with any amount of certainty what will happen. Do we foresee the need to adjust the current vaccines that are available? Right
now, as we speak, the current vaccines that are available are able to handle the variants that are also in circulation. So there's not really much worry at the moment about the vaccines that are available. They're able to really handle the variants that are circulating. But also we know that a lot of research is ongoing. So in case there are variants that come that don't respond to the vaccines, then the research teams are also working on that. But right now, that is not a worry.
Just give us a sense of how Africa is faring, compared to the rest of the globe in terms of cases, deaths, and then vaccine uptake.
So for example, when you look at vaccination in the rest of the world, in Africa, only 38% of the people have received at least one dose of the vaccine, compared to 70% in the rest of the world. So you see a very big discrepancy in vaccination. And likewise, when you look at the statistics in the world, you find that Africa is contributing, in terms of numbers of cases, Africa contributes only about 1.6 million cases of all the global cases. So we have, up to now, we have about 761 million cases that have been recorded globally. And of that, Africa is contributing only 1.6% of that. That is 12 million. So we see that there are very few cases in Africa, despite the very low vaccination level that we have.
Thank you so much for those insights as we continue to live in a changed world after the COVID-19 pandemic, where it will continue to be for the rest of our lives something that we need to be vigilant of. Professor Jayne Byakika-Tusiime from the World Health Organization giving us an update there.